Today we're gonna see about typhoid fever. This is an illness you get from Salmonella typhi bacterium. It causes a high fever, flu-like symptoms and diarrhea. You can be contagious with the typhoid even if you don't feel sick. Typhoid can be life-threatening and should be treated promptly with the antibiotics. If you live on or travel to an area where the typhoid is common, you should get vaccinated. The typhoid fever starts with a fever that gets progressively higher over the few days. Other symptoms follow as the bacteria spreads in our body. Here the symptoms of the typhoid fever like high fever, chills, loss of appetite, stomach pain, that is abdominal pain, and you can have the rashes, cough, muscle aches, headache, nausea, vomiting, diarrhea or constipation. What is typhoid fever? This is an illness that is caused by the bacterium Salmonella typhi. It infects your small intestine, gut, and causes a high fever, stomach pain, and other symptoms. The typhoid fever is also called the enteric fever. You will commonly hear the paratyphoid fever mentioned along with the typhoid. The paratyphoid fever is similar to the typhoid fever with mild symptoms. It is caused by the Salmonella paratyphi. The S. typhi and the Salmonella paratyphi are different than the Salmonella bacteria that causes the salmonellosis, a common type of the food poisoning. What does the typhoid fever affect? The typhoid fever is most common in the rural areas of the developing countries where there isn't the modern sanitation. Countries in South and the Southeast Asia, Central and the South America, Africa and the Caribbean are the most affected by the typhoid. Travelers are most at the risk when visiting the Pakistan, India or Bangladesh. Children are more likely to get typhoid than adults. How common is the typhoid fever? It is estimated that 11 million to 21 million people around the world get the typhoid each year. It is rare in the US, Canada, Japan, Western Europe and Australia. What is the long-term carrier of the typhoid fever? Some people continue to be contagious with the typhoid fever even after they have recovered. You can spread the typhoid for a year or more with no symptoms. It is important to get tested for Salmonella typhi after you feel better to make sure you can't spread it to the other people. What is the difference between the typhoid and typhus? While the names sound the same, the typhoid and the typhus are different illness caused by the different bacteria. The symptoms are similar so much so that the doctors used to think that they were the same illness. We know they are different illness, but the similar name stuck, and so to the confusion it causes. What are the symptoms of the typhoid fever? Here we can look for the symptoms of the typhoid fever. They get its name from the like a high fever that can last for weeks if left untreated. It often gets progressively worse over the few days. Other symptoms of the typhoid fever include headache, chills, loss of appetite, stomach pain, and as I said before, they have raw spots, that is rash or faint pink spots, usually on your chest or stomach. It also causes the cough, muscle aches, nausea, vomiting, diarrhea, or constipation. What causes the typhoid fever? This is caused by the bacterium Salmonella typhi. It lives in the gut, intestines of the infected people and can contaminate the food and water. How does the typhoid fever spread? The typhoid fever usually spreads through the food or water contaminated with the Salmonella typhi. This can happen if someone with the typhoid touches something that you can eat or drink without washing their hands. It can also happen if the wastewater that has poop or pee in it that gets into water you drink or food you eat. You can get typhoid from another person if they don't wash their hands after going to the bathroom. When they touch the surfaces and objects like phones or the doorknobs, they can leave the bacteria behind that can transfer to the next person who touches it. What are the stages of the typhoid fever? You can develop the symptoms of the typhoid fever gradually in 4 stages. Early treatment with the antibiotics can help you from the progressing to the later stages. Step 1. You can start getting the typhoid symptoms anywhere from 5 to 14 days after coming in contact with the Salmonella typhi. The first symptom is a fever that gets higher over the few days called the stepwise. Since it goes up in steps, the bacteria is moving into your blood in this stage. Stage 2. Around the second week of the fever, the bacteria is multiplying in your pH patches, part of your immune system that identifies the harmful invaders. You will start experiencing the abdominal pain and other stomach pain, like symptoms like diarrhea or the constipation. You might get the rose spots, small pink dots on your skin that look like rash. Stage 3. If not treated with the antibiotics, the bacteria can cause the severe damage, usually around the third week after your symptoms start. Some people get the serious complications like internal bleeding and encephalitis, that is inflammation in your brain. If not treated with the antibiotics, the stage 4 is most people begin to recover. Your high fever begins to come down. The salmonella typhi can live in your gallbladder without causing the symptoms, which means may still be contagious even after you feel better. How is typhoid fever diagnosed? Your healthcare provider will use your symptoms, your travel history, and lab tests to diagnose the typhoid fever. They will give you a physical exam and listen to your heart and lungs. It is very important to tell your provider if you have traveled recently or think you have been exposed to typhoid. Otherwise, they might not know to test for it. They will also use the information to decide what treatment to give. What are all the tests can be done to diagnose the typhoid fever? Your healthcare provider will take the samples of body fluids or tissue to test for the signs of typhoid. They might take the samples of your blood. Your healthcare provider will use a needle to take a small tube of blood from your arm. Poop or stool. Your healthcare provider will give you a sterile container and instructions on how to collect a sample. Urine. You may be asked to pee into a cup given up to you by your healthcare provider. Your provider might thumb your skin and take a sample with a small razor or scalpel. Bone marrow. Your provider will numb your skin and use a special needle to get a sample of the inside of your bones. It is rare that you ever need this test for the diagnosis. They may also take the X-rays, that is, pictures of inside your body to look for the changes in your lungs. Treatment for the typhoid fever. They treated with antibiotics. Some newer types of the bacteria are able to survive the antibiotic treatments, so you will be treated with the different antibiotics depending upon what type of blood you have and where you got sick. Paratyphoid fever is also treated with the antibiotics. Medications like azithromycin, carbamazepine, ofloxacin, levofloxacin, ciprofloxacin, cefixoxime, and cefotaxime, cefixime. Also, if your case is severe, you may be treated with steroids like dexamethasone. Antibiotic resistance in the typhoid. Bacteria like Salmonella typhi can sometimes develop the resistance to medication. This means that the antibiotics don't worry to destroy them anywhere. That is the antibiotic resistance. Many cases of the typhoid can't be destroyed by the antibiotics we once used, but some drugs still work on them. Some are extremely drug resistant. XDR typhoid and only a few antibiotics still work on them. This is one of the reasons that getting vaccinated to prevent the typhoid is so important. Health officials are concerned that we may no longer be able to treat the typhoid if available medicines stop working. We will be treated with the antibiotics that works on the kind of typhoid if we have based on the results of strain testing. How do I take care of myself with the typhoid fever? To take care of myself, make sure you finish all your medicines as prescribed by your healthcare provider. Ask your provider if it is safe to take non-steroidal anti-inflammatory drugs like ibuprofen, advil, naproxen sodium, and acetaminophen for the pain or fever. How soon after the treatment for the typhoid fever will I feel better? These are the questions that are asked by patients. If you have treated earlier with the antibiotic, you should start to feel better in a few days. It might take a week to 10 days to feel completely recovered. Vaccines for preventing the typhoid fever. There are 2 vaccines. They don't last forever. You need to get additional doses to stay protected. They greatly reduce your risk but don't guarantee you won't get typhoid. The vaccines may provide some protection against a paratyphoid fever, though this hasn't been tested. One is oral vaccine for typhoid is 4 pills that you take every other day as of the December 2020. It is no longer available from the manufacturer. Another one is injectable vaccine or shot. The injectable vaccine for the typhoid is a single shot. You need to get it at least 2 weeks before you arrive in the area where the typhoid is common, so your body has a time to build up the defenses that they can make the antibodies. Children over the 2 years can get the typhoid shot. You will need to get a booster shot every 2 years to stay protected. Vaccines are the best way to protect yourself from the typhoid. So don't make the food for others if you are sick. Wash your hands with soap and water before and after preparing the food. Wash surfaces and utensils used for the food preparation and eating before and after use. If you are unsure whether the food you are eating is safe, eat mostly well cooked or packaged food. Don't drink untreated water or eat food prepared with the untreated cover. If you are unsure, it is safest to use the bottled water to drink and cook with. Depending on how soon you are treated for the typhoid, you can feel better in as little as a few days after starting the antibiotics. You may still be contagious for a long time after your symptoms go away. Typhoid relapse. Some people with the typhoid fever get sick again after they seem to be fully recovered. This is called relapse. It usually happens about a week after finishing the antibiotics, but in a few cases it is happened the weeks or months later. Your symptoms will probably be milder than the first time you had typhoid. Typhoid fever may seem like a plague of the past, but people all over the world still get very sick from it. If you live in or you are traveling to an area where the typhoid is common, get vaccinated. This is the best way to keep from getting ill and spreading the course. Thank you.